शुभकामनाएं। हर वर्ष योग दिवस के अवसर पर मैं किसी न किसी आयोजन में आप सभी के बीच उपस्थित रहता हूं। आप सबके साथ मिलकर के योग करने का आनंद भी यादगार रहता है। लेकिन इस बार विभिन्न दायित्वों की वजह से मैं अभी अमेरिका में हूं। इसलिए आप सभी से वीडियो संदेश के माध्यम से जुड़ रहा हूं। साथियों, आपको ये भी बता दूं कि भले मैं आपके बीच योग नहीं कर पा रहा हूं, लेकिन योग करने के कार्यक्रम से भाग नहीं रहा। और इसलिए आज शाम को भारतीय समय के अनुसार शाम 5:30 बजे करीब करीब संयुक्त राष्ट्र यूएन के मुख्यालय में जो विशाल मात्रा में योग कार्यक्रम हो रहा है, मैं उसमें शामिल हूंगा। भारत के आह्वान पर दुनिया के 180 से ज्यादा देशों का एक साथ आना ऐतिहासिक है, अभूतपूर्व है। आप सबको याद होगा 2014 में जब यूएन जनरल असेंबली में योग दिवस का प्रस्ताव आया तो रिकॉर्ड देशों ने इसे समर्थन दिया। तब से लेकर आज तक अंतर्राष्ट्रीय योग दिवस के जरिए योग एक वैश्विक आंदोलन बन गया है, ग्लोबल स्पिरिट बन गया है। साथियों, इस साल योग दिवस के कार्यक्रमों को ओशन रिंग ऑफ योगा इसने और विशेष बना दिया। ओशन रिंग ऑफ योगा, इसका आइडिया योग के विचार और समुद्र के विस्तार के पारस्परिक संबंध पर आधारित है। सेना के जवानों ने भी हमारे जल स्रोतों के साथ एक योग भारतमाला और योग सागरमाला बनाई है। इसी तरह आर्कटिक से लेकर अंटार्कटिका तक भारत के 2 रिसर्च बेस यानी पृथ्वी के 2 ध्रुव भी योग से जुड़ रहे हैं। योग के इस अनूठे सेलिब्रेशन में देश दुनिया के करोड़ों लोगों का इतने सहज स्वरूप में शामिल होना योग के प्रसार और प्रसिद्धि को, उसके महत्व को उजागर करता। भाई और बहनों, हमारे ऋषियों ने योग को परिभाषित करते हुए कहा है, युज्यते एतत् इति योग, अर्थात जो जोड़ता है वो योग है। इसलिए योग का ये प्रसार उस विचार का विस्तार है जो पूरे संसार को एक परिवार के रूप में समाहित करता है। योग के विस्तार का अर्थ है वसुधैव कुटुंबकम की भावना का विस्तार। इसलिए इस वर्ष भारत की अध्यक्षता में हो रहे G20 समिट की थीम भी वन अर्थ, वन फैमिली, वन फ्यूचर रखी गई है। और आज पूरी दुनिया में करोड़ों लोग योगा और वसुधैव कुटुंबकम की थीम पर एक साथ योग कर रहे हैं। साथियों, हमारे योग इसके संबंध में ग्रंथों में कहा गया है, व्यायामात लभते स्वास्थ्यम, दीर्घ आयुष्यम बलम सुखम। अर्थात योग से, व्यायाम से हमें स्वास्थ्य, आयुष और बल मिलता है। हम में से कितने ही लोग जो बीते वर्षों में योग से नियमित जुड़े हैं, उन्होंने योग की ऊर्जा को महसूस किया है। व्यक्तिगत स्तर पर हमारे लिए बेहतर स्वास्थ्य कितना महत्वपूर्ण होता है, ये हम सब जानते हैं। हमने ये भी देखा है कि जब हम स्वास्थ्य संकटों से सुरक्षित होते हैं, तो हमारा परिवार कितनी ही परेशानियों से बच जाता है। योग एक ऐसे स्वस्थ और सामर्थ्यशाली समाज का निर्माण करता है जिसकी सामूहिक ऊर्जा कई गुना ज्यादा हो जाती है। बीते वर्षों में स्वच्छ भारत जैसे संकल्पों से लेकर स्टार्टअप इंडिया जैसे अभियानों तक, आत्मनिर्भर भारत के निर्माण से लेकर सांस्कृतिक भारत के पुनर्निर्माण तक, देश और देश के युवाओं में जो असाधारण गति दिखी, उसमें इस ऊर्जा का बहुत बड़ा योगदान है। आज देश का मन बदला है और इसलिए जन जीवन भी बदला है। साथियों, भारत की संस्कृति हो या समाज संरचना हो, भारत का आध्यात्म हो या हमारे आदर्श हो, भारत का दर्शन हो या दृष्टि हो, हमने हमेशा जोड़ने, अपनाने और अंगीकार करने वाली परंपराओं को पोषित किया है। हमने नए विचारों का स्वागत किया, उन्हें संरक्षण दिया। हमने विविधताओं को समृद्ध किया है, उन्हें सेलिब्रेट किया। ऐसी हर संभावना को योग प्रबल से प्रबलतम करता है। योग हमारी अंतःदृष्टि को विस्तार देता है। योग हमें उस चेतना से जोड़ता है जो हमें जीव मात्र की एकता का एहसास कराती है, जो हमें प्राणी मात्र से प्रेम का आधार देती है। इसलिए हमें योग के जरिए हमारे अंतर विरोधों को खत्म करना है। हमें योग के जरिए हमारे गतिरोधों और प्रतिरोधों को भी खत्म करके रहना है। हमें एक भारत श्रेष्ठ भारत की भावना को विश्व के सामने एक उदाहरण के रूप में प्रस्तुत करना है। भाइयों बहनों, योग के लिए कहा गया है, योगः कर्मसु कौशलम, यानी कर्म में कुशलता ही योग है। आजादी के अमृत काल में ये मंत्र हम सभी के लिए बहुत अहम है। जब हम अपने कर्तव्यों के लिए समर्पित हो जाते हैं तो हम योग की सिद्धि तक पहुंच जाते हैं। योग के जरिए हम निष्काम कर्म को जानते हैं। हम कर्म से कर्म योग तक की यात्रा तय करते हैं। मुझे विश्वास है योग से हम अपने स्वास्थ्य को भी बेहतर बनाएंगे और इन संकल्पों को भी आत्मसात करेंगे। हमारा शारीरिक सामर्थ्य, हमारा मानसिक विस्तार, हमारी चेतना शक्ति, हमारी सामूहिक ऊर्जा विकसित भारत का आधार बनेंगे। इसी संकल्प के साथ आप सभी को योग दिवस की एक बार फिर बहुत बहुत शुभकामनाएं।
So this was the Honorable Prime Minister, his broadcast which we released some hours ago. Hello and welcome to the Integral Healthcare Forum. And today happens to be the International Yoga Day. But long before this Yoga Day was accepted by the United Nations, the UN General Assembly, the cosmic phenomena of the summer solstice on 21st of June has been quite there. And what a convergence of a commemoration which is happening on the summer solstice, where we are having the longest day all through the year. And we at Rethink India felt to commemorate this very day as a part of integral healthcare, because in the Indian tradition, Surya, the Arogyam, the health emanates from sun god, and that's where it's came all through. And since yoga, as the Honorable Prime Minister was talking about in his address, because he has become a global statesman and he took forward the philosophical precept of yoga to the geopolitical, to the political, to the local, to the individual level itself. He said we have to resolve our own internal conflicts. So there are conflicts at the global level. We have the Russia-Ukraine war now entering into a year and a half or so, but we have internal conflicts as well. So yoga per se has got a multifaceted implication out there. Today also happens to be, it's commemorated long back, the World Music Day. And music in the Indian tradition, again, the Nada Vidya, apart from the Surya, it is the Mantra Shakti which has been out there. And so it's also a commemoration of the World Music Day. And today at Rethink India, in this commemoration, we would be commemorating, we would be felicitating the Saptarishis of the integral health from various walks of the national healthcare ecosystem. We welcome Professor Dr. Ajay Singh, the Honorable Director of the All Indian Institute of Medical Sciences from Bhopal, the Bhojpal, the land of Shamala Hills, the Shyamatal, lovely locales from the Ajab Gajab Madhya Pradesh, the heart of India. So we are so very privileged and honored to have Professor Dr. Ajay Singh with us in this Integral Healthcare Forum. We also have from India Pharmacopoeia Commission. Now this is the commission which has a resolute mandate of sustaining India's preeminence global position as the pharmacy of the world. And they are doing some stellar work. We would be coming to that. We have Gaurav Singh ji, who is the Principal Scientific Officer at the IPC. We have an eminent Imzonian who is a technocrat also over there, and the second opinion, the integration of the entire care continuum. So each one of the Saptarishis, as we will be learning, are integrating the healthcare part in one way or the other. I welcome Dr. Sumati Sundar from the Chennai School of Music Therapy. Music therapy as a clinical practice has become her mandate, and CSMT is doing a phenomenal work on that space, and more and more guests will be joining our other Saptarishis. Today is also the solemn occasion of the Punya Tithi of one of the, I would say, savants of modern India, Dr. Keshav Baliram Hedgewar, who emerged as a parallel political thought process leader, who not as a politics, he saw India scattered into Indian society scattered into various divisions, caste, creed, region, religion. We were all segmented into so many, I would say, identifiers over there. And in the year 1925, very early year, Dr. Keshav Baliram Hedgewar, with that mandate, he founded one of the world's largest volunteer corps, the Rashtriya Swayam Sevak Sangh. And today is his Punya Tithi as well. So a lot of convergence over there. So we felt, since we are invoking the philosophical notion of yoga, we felt like giving away the Dr. Keshav Baliram Hedgewar integral healthcare honor, dedicate in his name. He was a medical professional himself in those very early years. In 1916, he was a trained medical professional from Calcutta Medical College. So at that time, we had a very handful of medical graduates coming out from the system. So just as a tribute to this savant who has really, in 2023, when we are here, the organization which he, the ideological precepts, the organization, the vision with which he set out that it's going to complete another 100 years in just 2 years' time. So we would just play a small video giving a brief background of Dr. Keshav Baliram Hedgewar, because that commemoration is again how relevant this International Yoga Day and the Integral Healthcare Awards recognitions we are trying to present to the Saptarishis today. So just a small film produced by the Sunset TV. So let's watch it.
You have to restart this with the sound. We can't hear any sound in this, please.
उस दौरान पूरे देश में आवाज उठ रही थी। 1905 के बंग भंग विरोधी आंदोलन का दमन करने के लिए अंग्रेजों ने वंदे मातरम के नारे पर पाबंदी की। लेकिन नागपुर के एक सरकारी स्कूल में पढ़ने वाले एक बच्चे के मन में अंग्रेजी हुकूमत के खिलाफ नफरत धीरे धीरे विद्रोह का रूप ले रही थी। 1907 में किसी दिन स्कूल का निरीक्षण करने जैसे ही एक अंग्रेज निरीक्षक दाखिल हुए, उनका स्वागत वंदे मातरम के उद्घोष से हुआ। धीरे धीरे स्कूल के हर क्लास में यही नारा गूंजने लगा। अंग्रेजी हुकूमत को धता बताने वाला ये बालक था केशव, जो आगे चलकर डॉक्टर केशव राव बलिराम हेडगेवार के नाम से भारतीय राजनीतिक और सामाजिक आंदोलन का बड़ा नाम बन गया। डॉक्टर हेडगेवार का जन्म 1 अप्रैल 1889 को नागपुर में हुआ। हेडगेवार जन्मजात देशभक्त थे। बचपन से ही उनके मन में एक सवाल उठता कि हम आखिर गुलाम क्यों हैं। स्कूली पढ़ाई के बाद वो मेडिकल की पढ़ाई करने के लिए कोलकाता चले गए। कोलकाता उन दिनों क्रांतिकारी आंदोलन का केंद्र था। हेडगेवार भी जल्द ही क्रांतिकारी गतिविधियों में शामिल हो गए और अनुशीलन समिति नाम की क्रांतिकारी संस्था से जुड़ गए। 1916 को डॉक्टर की उपाधि लेने के साथ ही वो वापस नागपुर आ गए। नागपुर से ही उन्होंने स्वतंत्रता आंदोलन में अपनी भूमिका निभानी शुरू की। जल्द ही वो कांग्रेस से जुड़ गए और कुछ ही समय में विदर्भ प्रांतीय कांग्रेस के सचिव बन गए। 1920 में जब नागपुर में कांग्रेस का राष्ट्रीय अधिवेशन हुआ, तो डॉक्टर हेडगेवार पर ही अधिवेशन की व्यवस्था की जिम्मेदारी थी। अधिवेशन में उन्होंने पहली बार पूर्ण स्वतंत्रता को लक्ष्य बनाने के बारे में प्रस्ताव पेश किया, लेकिन वो तब पारित नहीं हो सका। गांधी जी से प्रभावित होकर वो कांग्रेस के असहयोग आंदोलन में बढ़ चढ़कर हिस्सा लेने लगे। 1921 में सत्याग्रह करते हुए उन्होंने गिरफ्तारी दी और 1 साल तक जेल में रहे। कांग्रेस से जुड़े होने के बावजूद उन्हें लगता था कि आजादी मिलने के बाद भी समाज में राष्ट्रवाद की भावना स्थायी तौर पर मजबूत रहनी चाहिए। एक मजबूत राष्ट्र के लिए उनकी सोच एक स्वाभिमानी और संगठित समाज के निर्माण की थी। इसी सोच के साथ 1925 में विजयदशमी के दिन उन्होंने राष्ट्रीय स्वयंसेवक संघ यानी आरएसएस की स्थापना की। संघ की शाखाओं के जरिए उन्होंने युवाओं के मन में शक्ति, सामूहिकता, अनुशासन और राष्ट्र गौरव के साथ ही समाज के लिए निस्वार्थ भाव से त्याग करने की प्रेरणा दी। कड़ी मेहनत के बूते करीब 15 साल तक पूरे देश में घूम घूम कर वो संघ की विचारधारा के प्रचार और स्वयं सेवकों को जोड़ने में कामयाब रहे। डॉक्टर हेडगेवार भारत की प्राचीन संस्कृति और परंपराओं के प्रति अपार श्रद्धा और विश्वास रखते थे, लेकिन समाज के विकास और संगठन के लिए वो आधुनिक साधनों का उपयोग करने से पीछे नहीं हटे। वो राष्ट्रहित में व्यक्तिगत मतभेदों को दूर रखने से भी परहेज नहीं करते थे। 1930 में गांधी जी के नेतृत्व में शुरू हुए सविनय अवज्ञा आंदोलन के दौरान उन्होंने विदर्भ में जंगल सत्याग्रह में स्वयंसेवकों के साथ भाग लिया और 9 महीने जेल में रहे। डॉक्टर हेडगेवार आलोचनाओं को भी सम्मान दिया करते थे। संघ की गैर राजनीतिक कार्यशैली पर कई बार आपत्ति उठी, लेकिन उन्होंने इसका कभी भी कठोर प्रतिकार नहीं किया और संघ को दिशा देते रहे। हेडगेवार न केवल समान विचारधारा वाले लोगों में लोकप्रिय थे, बल्कि दूसरे दलों के नेताओं से भी उनके काफी अच्छे संबंध रहे। अपने जीवन में वो लोकमान्य बाल गंगाधर तिलक और सुभाष चंद्र बोस के काफी करीबी रहे। महात्मा गांधी के साथ भी वो देश की राजनीति और भविष्य पर चर्चा किया करते थे। सुभाष चंद्र बोस के साथ तो उनका गहरा रिश्ता था। नेताजी के साथ मिलकर वो कई बार संघ के जरिए नए भारत के निर्माण पर चर्चा करते। गंभीर रूप से बीमार होने पर सुभाष चंद्र बोस उनका हाल जानने खुद उनके पास गए, लेकिन नेताजी से मुलाकात के 2 दिन बाद ही 21 जून 1940 को डॉक्टर केशव राव बलिराम हेडगेवार का निधन हो गया। उनका शुरू किया गया संगठन आरएसएस न सिर्फ इस वक्त देश के सबसे महत्वपूर्ण गैर राजनीतिक संगठनों में से एक है, बल्कि ये स्वयं सेवकों का दुनिया का सबसे बड़ा संगठन भी बन चुका है। ब्यूरो रिपोर्ट, राज्यसभा टीवी।
So this was a short profile of Dr. Hedgewar, who started a non-political organization which has become the world's largest volunteer corps. And the political aspect of the Rashtriya Swayamsevak Sangh actually started with the Bharatiya Jan Sangh, which was taken forward by Dr. Shyama Prasad Mukherjee, whose Punyatithi is just 2 days from now, where he got martyrdom in Kashmir, and then Pandit Deendayal Upadhyay. So with this short background, the malaise of disintegration of India that was healed by Dr. Hedgewar, and today we have this great privilege to honor the Saptarishis of India's healthcare ecosystem, coming from various walks, and we talk about an integral healthcare paradigm, which I would say all the savants are quite, they have deeper inroads into that. So I will just start that felicitation part of it. So just so as I said earlier, he was a medical doctor from Calcutta Medical College way back in 1916, and his philosophy had always been for a rational, reasoned, and a scientific discourse. We are all talking about a rule-based ecosystem across the globe, not a whim-based ecosystem, and that was what Dr. Hedgewar stood for all through. And his core aphorism, what he said, that accept only that which stands to your reason. I would request Dr. Surbi to just read out this aphorism in scientific temper, which you all know. Yeah.
Except only that. Just a moment.
Okay. So accept only that which stands to your reason. Never accept anything merely because it is preached by some great leader. Test its truth on the touchstone of your intellectual discrimination. So this is again a kind of a establishment of the scientific and the rational discourse, which we always had in India. Because of some of the years in our space, we got invaded. We had all kind of mayhem in the country. Somehow this wisdom somehow got lost. But now, evidence-based medicine, as we all call it, the traditional systems of medicine, the various aspects of healthcare ecosystems, they are converging. The Ministry of Health and Family Welfare is working towards an integrated paradigm of healthcare in a big way. We move forward, and this was our illustrious honor roll call in the year 2021, ranging from Professor Baliram Bhargav to Professor Anu Mishra, the whole different spaces from medical astro to the integrationist, integrative medicine practitioner, the young Amazonians. So this forum has been carrying forward that spirit, that flag further and forward, and also how healthcare is helped by tourism. So we had former Secretary Tourism as to how tourism helped healthcare in a big way. So we try to bring in many facets of integration to the domain of healthcare. Professor Y.K. Gupta, Professor K.K. Agrawal, who was the pioneer in establishing, in foreseeing that a medical hospital can be converted into a medical college. Now we are having medical colleges all across the country. The district hospitals are being converted. So Professor K.K. Agrawal, one integrator who tried to do about it. So just a small, that this is the legacy which we are trying to take forward, including the National Institute of Ayurveda, Jaipur, the School of Medicine and Scientific Technology, IIT Kharagpur. So this was a whole honor roll call. This year we decided to have the Saptarishi Mandal out here to be felicitated on this August forum, to keep it short and sweet, and very eminent people to come over there. So first and the foremost, as Bharat Varsh mein Sangeet, music is not just a means of entertainment. It is more about meditation. And today being the World Music Day, we are commemorating it first. And जो Honorable Prime Minister ने भी कहा कि योग, तो आत्मा का परमात्मा से जो योग है, संगीत उसमें बहुत एक सहायक भूमिका निभाता है. So we would like to honor the Chennai School of Music Therapy with Dr. Keshav Baliram Hedgewar honor for having given a definitive academic shape to the entire domain of music therapy through its wide range of introductory, short-term, and modular courses, along with the longer duration ones like the CPMT and PGDMT, contributing immensely to the cause of establishing music therapy clinical practice to modern healthcare delivery system in India. So I request Dr. Sumati Sundar to accept this token tribute from this August forum, and also illumine us about what all I would say down south, there was always a complaint, you always start from up north, but संगीत की जो लहरियां हैं समुद्र के साथ जो आती हैं. So we started off with Chennai. I would request Dr. Sumati Sundar to accept this token tribute and also illumine us over here. Over to Dr. Sundar. Ma'am, Dr. Sumati Sundar, ma'am. Yeah, you have to unmute yourself, ma'am. Yeah. Yes, ma'am.
Yeah. Can you hear me?
Yes, ma'am. Loud and clear.
Yes, ma'am.
Yeah. So thank you so much, and namaste and good evening to all of you from Chennai School of Music Therapy, called CSMT, based in Chennai. And at the outset, it's a great pleasure and honor to be present in this August gathering and receive this prestigious honor on behalf of CSMT. And personally, I thank profusely the organizers and the jury of Rethink India for choosing us to receive this honor. I'm grateful to the entire team of CSMT who have been working, tirelessly to have made this honor possible. CSMT has been pioneers in developing and establishing music therapy as an evidence-based complementary medical practice under the ambit of integrative health with the principles of salutogenesis, focusing on factors of health and wellness for patients since the year 2011 in India. The focus of music therapy as an integrative health practice as a part of mainstream medicine is to adopt a holistic approach to treatment, both to support pathogenesis and also to heal the patients visiting the hospitals. One of the foremost medical universities that I had the opportunity to set up music therapy department with a plethora of courses with 1-year postgraduate diploma, master's degree in music therapy and a PhD program in music therapy was Sri Balaji Vidyapeeth, the Pondicherry-based Balaji Vidyapeeth. And now the Center for Music Therapy Education and Research, which I was the director, has been now made into the Institute of Salutogenesis and Complementary Medicine. So I'm so honored, to receive this award on behalf of CSMT. And we wouldn't have been able to do this without the amazing medical community who really wanted to integrate a holistic treatment approach in a pioneering effort as early as in 2011, 12, 13, by integrating music as a way to create an optimum healing environment in the hospitals for the patients, thereby promoting health and wellness to the patients and the neighboring community, of course, through CSMT. I want to thank all our collaborators, both in India as well as abroad, the healthcare universities, hospitals, research centers, who have introduced music therapy as a complementary medicine in a pioneering effort. And we have had the wonderful opportunity to work with them in establishing this therapy modality in an evidence-based manner. For more than 12 years, CSMT has been supporting hospitals to incorporate health-promoting mechanisms, taking into account the multidimensional determinants of health to be biological, psychological, social, cultural, and ecological factors using music. And I assure you, CSMT will continue to spread the wings and strive for excellence to establish music therapy as an integrative health practice more deeply in our nation. Thank you so much, one and all.
Thanks a lot, ma'am. I would request Dr. Surbhi to comment upon, and being a practicing medico.
Indeed, it's such a pleasure. I think it's our good fortune that we are, on International Yoga Day and World Music Day. We, got an opportunity to hear Dr. Sumati Sundar from the Chennai School of Music Therapy. And I believe that music is in itself a medicine, in a great way. The sur and this effect impact on the brain. Each note has an impact on the brain. And I myself am a music freak and have been trained into classical music through legacy from my family, and also feel that the various ragas, the time they're sung and how they're treating the various healthcare conditions. There is Rag Yaman for pregnancy, there is Rag Bhairavi for arthritis, so on and so forth. So I feel that this Paddhati of our Indian healing systems, the music therapy, should go even further, gallops in the time and years to come. Thank you.
So what a wonderful commemoration of the World Music Day by bringing music to the domain of healing. And this is what the Samagrata, जो योग की बात प्रधानमंत्री जी ने कही और जो भारतीय मनीषा ने हमेशा से योग की बात कही है, एक समग्रता की बात कही है, एक इंटीग्रेशन की बात कही है कि म्यूजिक भी हेल्थ केयर से जुड़ रहा है. So this is the commemoration. This is what Dr. Hedgewar ji stood all through his life, and he really sowed the seed of that giant ideological thought process, which was to develop the character of the individuals. And that is what we are commemorating today. Moving forward, we would like to felicitate and cheer the contribution of Indian Pharmacopoeia Commission for having embarked upon the illustrious journey to harmonize the Indian pharmacopoeia with the global standards of US, Europe, Japanese, and British. They are digitizing the critical publication to expand its subscriber base, and having incorporated the national list of essential medicines, having 384 drugs under its ambit, all aimed at sustaining the credibility of India as the pharmacy of the world. भारत विश्व गुरु था, है और रहेगा. तो भारत की ये जो ज्ञान संपदा है और जिसके ये अग्रणी धारक है इंडियन फार्माकोपिया कमीशन, डॉक्टर रघुवंशी was to be here. He has emerged to be the drug controller general of India. He was in some pressing assignments, so he has deputed the principal scientific advisor Gaurav Singh ji to receive this token tribute in the name of Dr. Keshav Baliram Hedgewar ji on this occasion. And without pharmacy, the entire healthcare paradigm, the entire healthcare healing, it just cannot take place. I would request Dr. Gaurav Singh ji to accept this tribute and also address the forum.
So many thanks for selecting Indian Pharmacopoeia Commission for this honor, sir. So I am representing Indian Pharmacopoeia Commission as our director, Dr. Rajiv Singh Raghuvanshi, could not join this meeting due to his another urgent meeting in the ministry actually. So he has nominated me. So I feel honored also, and thank Rethink India Foundation for recognizing the work that has been carried out by the Indian Pharmacopoeia Commission in the field of setting standards for drugs which are marketed or manufactured in India. So the Indian Pharmacopoeia Commission is an autonomous organization under the Ministry of Health and Family Welfare. And our ministry has given us the mandate to set the standards of drugs, along with providing the reference standards to the stakeholders. So which these standards are used in the quality control testing of the medicines. Beside these two works, we also publish the National Formulary of India, which is a book that contains drug monographs, which are usually referred by the medical practitioners, the other healthcare professionals. So by this way, IPC is contributing in the healthcare system of the country. So with these words, I thank the Rethink India Foundation and all your team for giving us this opportunity and giving us this honor. Thank you, sir.
Thank you so much, Gaurav ji. And we've also learned that Indian Pharmacopoeia Commission is also working on one herb and one standard. India has such a vast repository of Ayurveda formulations, and probably that's an area where IPC is moving forward. And we really are so very fortunate that we have such a stellar body which is setting out standards, which is harmonizing with the global standards. And we hope in years and times to come, the IPC standards would perhaps become the preeminent global standards with the kind of drug research which is happening in India. So thank you very much. And
especially I would like to add in here that the generic drugs with the Jan Aushadhis and the immense affordable drugs being made available at the various government Jan Aushadhi Kendras, this is a great, I should say, a revolution in its own way, wherein affordable medicine is being promoted in a major way. So 3 cheers for this,
Yes. Yeah. Thank you so much. Moving forward, we would now like to felicitate one of the next generation, the new generation AIMS, the All India Institute of Medical Sciences, Bhopal. We have with us Dr. Ajay Singh sir from All India Institute of Bhopal, and the very specific aspect for which AIMS Bhopal is being recognized for this felicitation is their formal recognition of the value of Ahar into the entire healthcare space. So the Integral Healthcare Compact, which we have been talking about, talks about Ahar, Vihar, Vichar, and then Aushadhi. So this quad is a term which is used more in the strategic affairs, but then the medicos are no less. They are the strategic healers across. So AIMS Bhopal is being honored with this Dr. Keshav Baliram Hedgewar Integral Healthcare Honor for having recognized the value of millets as a healthy and nutritious food by offering them to the inpatients thereby bolstering the cause of integral healthcare. And we all know that this is the International Year of Millets, which is being commemorated, and bringing that very nutritious aspect, जो श्री अन्न है हमारा, उसको अस्पताल में लेकर आने का जो एक अभिनव प्रयास अखिल भारतीय आयुर्विज्ञान संस्थान भोपाल ने किया है, बड़ा स्तुत्य है। और मैं निवेदन करूंगा प्रोफेसर डॉक्टर अजय सिंह सर से कि वो इस टोकन ट्रिब्यूट को स्वीकार करें। और
बहुत बहुत धन्यवाद। मैं एम्स भोपाल की तरफ से अपना आभार व्यक्त करता हूं, आप सभी लोगों का अभिनंदन करता हूं जिन्होंने एम्स भोपाल की इस छोटी सी पहल को आपने स्वीकार किया और रिकॉग्निशन दिया। जैसे आपने बताया कि हम लोगों ने शायद एम्स पहला इंस्टीट्यूट था मेडिकल का जिन्होंने मिलेट की को अपने इन हाउस जो इंडोर पेशेंट्स हैं उनकी डाइट को रेगुलर हम लोगों ने मिलाया। और आज भी जब हम लोगों ने योगा डे सेलिब्रेशन किया तो जितने भी प्रतिभागी थे सभी को हम लोगों ने ये मिलेट का ब्रेकफास्ट सर्व किया। और ना सिर्फ हम लोग अपने डाइट में इस चीज को इंक्लूड करते हैं, हम लोग रेगुलर सेंसिटाइजेशन प्रोग्राम भी आउटरीच एक्टिविटी के हिसाब से करते हैं। गांव में जाते हैं, शहरों में बच्चों के पास स्कूलों में जाते हैं जहां पे हम ये व्यवस्था कर सकें, उनको इस चीज के प्रति जागरूक कर सकें कि ये जो हमारा आहार है जो कि किसी वजह से इसको एक तरीके से इंफीरियर क्वालिटी ऑफ फूड आइटम माना गया था, ये फुल ऑफ न्यूट्रिशन है। हमारी बहुत सारी लाइफ स्टाइल डिजीजेज हैं जो हमको, चाहे वो ओबेसिटी हो, चाहे हाइपरटेंशन हो, चाहे वो डायबिटीज हो, चाहे वो कॉन्स्टिपेशन हो, ये सब के लिए ये छोटा सा यदि आहार हम आम जनता इसको लाएगी तो अपने प्रयोग में तो इससे सफल होंगे। ये हमने सफल एक प्रयास किया और हमारे मरीजों ने इसको बहुत ही बढ़ चढ़ के इसको स्वीकार किया, इसके लिए मैं उनका भी आभारी हूं। और मैं ये भी बताना चाहूंगा कि एम्स भोपाल इंटीग्रेटिव मेडिसिन पे एक बहुत बड़ा काम कर रहा है और हम लोग एक सेपरेट इंटीग्रेटिव मेडिसिन की ओपीडी भी चलाते हैं जिसमें हम लोग जो एविडेंस क्रिएट कर रहे हैं ट्रेडिशनल मेडिसिन और अपनी सो कॉल्ड मॉडर्न मेडिसिन के बीच में। और मेरा सपना यह है कि ये एक दूसरे के कॉम्पिटिटर नहीं होने चाहिए बल्कि कॉम्प्लीमेंट होने चाहिए एक दूसरे के, और उस पर मैं बहुत ज्यादा काम करूंगा। मुझे बहुत ही खुशी है, मैं जो हमारे साथ मैडम सुमैया सुंदर मैम जो कि चेन्नई से जुड़ी हैं, क्योंकि मैम आई वॉज ऑलवेज थिंकिंग दैट the music is a great healer, and I used to advise my faculty members that for cancer and the children the music system should be there, and I gave the order of putting some soft music for these wards. But I am looking forward to work with you, and maybe we both institute can work together for this. So this is my today is very special day for me because one of my dream was to integrate music in the modern medicine treatment. So thank you once again on the behalf of AIIMS for giving us this recognition. Thank you.
And what a lovely day that this is also integrating the spirit of Ek Bharat Shreshth Bharat. So from Bhopal to Chennai, the two institutions coming forward to collaborate on such a lovely aspect. And there has been a tube music at the Bhakti Vedant Hospital in Mira Road in Bombay for a long time. But as Sir said that the scientific evidence of things, and when AIIMS say something, then the whole world listens. So that is the repute and that is the credence from which integrative medicine is being furthered. Dr. Surbi, anything?
Absolutely, and it is so thrilling to hear that from ahar to vihar to vichar, the complete the spectrum of alternative therapy. We say it's alternative therapy, but this is integral healthcare, as Professor Dr. Ajay Singh so rightly said. And it is our privilege and honor to hear such scintillating thoughts. And ये प्रयोग में हो रहा है, ये सिर्फ बातें नहीं हो रही, ये प्रयोग में हो रहा है। इसके लिए आपको हमारा भूरी भूरी साधुवाद सर।
धन्यवाद। धन्यवाद.
Thanks a lot. Moving forward from Bhopal, इंटीग्रेशन की जो हम बात कर रहे हैं, समग्रता की जो हम बात कर रहे हैं, तो एक प्राइमरी, सेकेंडरी, टर्शरी का जो एक फॉर्मल मेडिसिन में जो एक विभेद है, द डिस्टिंक्शन ऑफ प्राइमरी, सेकेंडरी एंड टर्शरी, we somewhere feel that it needs it's a first, second and third opinion. Aims to Health, founded by Dr. Shashi Gogia, another exemplary Amazonian. He founded, and he's a technocrat as well. He has brought about a technological platform to facilitate the second opinion of ex-AIMS doctors. And AIMS to Health, we would hear it more about the philosophy of authoritative second opinion from Dr. Gogia himself. So AIMS to Health is being recognized for having facilitated the critical gap of credible second opinion by AIMS doctors, intertwining the established medical processes with the most modern communications technology, accelerating timely care of the patients concerned. As they all say, that accurate diagnosis, optimal investigation, and judicious medication, the hallmarks of the AIMS paradigm of Medicare. So through AIMS to Health platform, Dr. Gogia and the entire network of AIMS specialist doctors are really helping the nook and cranny of the country, where a specialized and a tertiary level second opinion has to be brought about. I would request Dr. Gogia to accept this token tribute from this forum, and also illumine us more about this platform and his plans further and forward, because ये primary care को tertiary care से integrate कर रहा है in a geography agnostic manner with the advent of, because telemedicine की बात तो होती है, but doctor to doctor telemedicine consultations ये platform facilitate करा रहा है. A doctor has taken the history of a patient, and an expert sitting at a higher place, they can really come together and treat the patient without they having to travel much over there. More from Dr. Gogia. Sir.
Thank you, Dr. Surpi, for honoring us, and also, being part of the Amazonian, these things. So we are all Amazonians. What we are trying to do is that finally, the tertiary care is very, very expensive, and more expensive than that, which is not even recognized, is the cost of traveling to the healthcare facility. But what was happening was, so far, telemedicine as a concept came up somewhere around in 2000, when they tried to do, say that they could, in fact, one of the first episodes of telemedicine were in Uttarakhand itself, and the Kailash Mansarovar Yatra, where Pooja Bedi, was mother of Pooja Bedi, whatever, had a problem, and they could treat her and advise her right from sitting from SGPG at Lucknow. So Uttarakhand does have some links that way. It is a hilly area. It has got difficulties of travel. In fact, my own initiation to telemedicine took place when I was traveling. I have a cottage in Mussoorie, and we were taking for a morning walk, and we saw people taking 4 people carrying a cot with a person who is just required a small little dressing. It was an orthopedic case. And I was wondering that, and they had not even reached the road. So you can imagine reaching the road, going to for a dressing, coming back for something which will cost 50 or 100 rupees. And for that, somewhere around 4,000-5,000 rupees has been spent, 4-5 man days lost. So this is what we are trying to correct. More importantly, when AIMS to Health was actually, the specialists don't have time. They are seeing patients, but still the number of patients they can see can be much more through telemedicine. What has happened is most specialists are localized in urban areas where there are not enough that number of patients. One neurologist is supposed to cater to 1 lakh population. You cannot get it in a rural area, as simple as that. That's why they concentrate in the cities. But even in the cities, there are some doctors, and AIMS people are famous for that, who want to do more, who want to spend their field time for some good activities. They can't do it because the patient can't come to them. So we have made this platform that AIMS doctor, and that's what we offer to Dr. Surbi also, that for your own organization, we can ask all the specialists to spare 1 to 2 hours a week only. The entire data is collected and made locally. So there are two forms of telemedicine. One is synchronous, which is done through video conferencing, like we're doing right now. More important, which is not even recognized, even during COVID, it was not recognized, is document sharing. The patient discharge summary, reports, his history. If the history is taken locally, the person out here doesn't have to take time in taking it. So the history is created locally by good doctors like Dr. Surabhi and all that. The history and details are shared beforehand so that even the online time is cut short and an opinion is given. And this is what we meant by second opinion. First opinion is already there locally. We provide the second opinion whether it really needs to come over or whether something can be done locally. And this is best done, as has already been pointed, between doctor to doctor, because a doctor can take a proper history. If a patient directly writes, he may write the wrong thing. He may be more concerned with his baldness when his problem may be somewhere else. Or he may send his reports. He may send an X-ray saying that, see, this is my X-ray chest, which may have old TB, heel TB focus. And now the specialist is concentrating on the TB when his problem is in the leg. So these things we want to correct through local healthcare providers who create the history, who consult, be the frontline level of care with the patient. Just call up for a second opinion so that they can do most of the things locally themselves and the patient doesn't need to travel. And we'll be very happy to join hands with your organization and provide that support. There will be some cost, but for organization like yours, we can look at the cost so that it's affordable for all. And we are doing a lot of free service also, but it will be more directed, and we are sure, because what is important for the specialists is not only that if they spend the time for giving these consultations, it should be spent usefully, because if the history is taken locally, at least the right person has taken it, we are sure we can give the right advice. If the person just says that, okay, I want to send across a patient and doesn't send this thing, the right advice will also not come. Thank you.
Thanks a lot, sir. And this is a fabulous initiative, and I would request Dr. Surabhi to just have further thanks. Yeah.
So this is a very profound platform, aims to health, I would say, and that healthcare in our country, if we see it from a macro perspective, 80 to 90% of the problems can be handled at the preventive and primary care level, provided we have good history taking, examination, and then the right time of referral to the specialists and the procedures is done timely, So in this regard, as Dr. Shashi Gogia sir very rightly said, that the complementarity or the tie-up between the history taking primary first level of contact doctor, or we can say a GP or a primary practitioner or the first point of contact, and then the further specialist opinion. So this is the first opinion and the second opinion. When this is combined, it's such a powerful combo that the patient gets authentic and genuine advice right at his where he's located. And it's very speedy redressal of healthcare problems. I myself came across so many cases in rural Uttarakhand that where I saw that there were patients who needed MRI spine. There were some neurosurgery cases, and we referred them to AIIMS Rishikesh, where we got their redressal done and surgeries were done. Also, some patients of cancer, even from Uttarakhand, who were referred to AIIMS Delhi, and their cancer surgeries were done very timely. So this is something which is dire need of the hour, and a great platform like Dr. Shashi Gogia says, AIIMS to Health is something like a savior.
And the most striking part, I would like to reiterate that this is a platform conceived and created by medicos, not technocrats. Now, today what is happening, technocrats are poking their nose in every domain, but the doctors are the ones who know the process in and out. And Dr. Gogia and his team, they are primarily medicos. They know the pain points and the kind of process flow what they have tried to bring about. It's really, and so that will make this platform a truly futuristic one. And it has integrated the primary care to the tertiary care in such a seamless fashion. So thank you so much, Dr. Gogia, for this lovely service. And we hope and pray that this really grows up into, as we call today, that the medical healthcare spaces, the unicorns of tomorrow, platform developed by Amazonians, it really takes on that scale and size and things like that. Moving forward, भारत में दशावतार की एक बहुत बड़ी परंपरा है. हमारे देश में जो देवभूमि उत्तराखंड, उसके दो हिस्से हैं, गढ़वाल और कुमाऊं। कुमाऊं को हम कूर्मांचल कहते हैं, एंड Kurmanchal has its distinctive geography and distinctive, I would say, challenges, healthcare challenges as well. And in this space of establishing the new generation aims, somehow the hills remained at the, I would say, they could not be fully fulfilled. The state of Uttarakhand got the aims in the plains of Rishikesh, not deep into the hills, and somehow even the extension of aims Rishikesh has been planned further in the plains. But then there are private medipreneurs who, out of their own inspiration and their own sweat and toil, they are working so very hard to provide world-class facilities and also bringing in a lot of expert doctors from all over to create Haldwani, which is the bottom of the hilly Kumaon. The entire Kumaon hill region starts from Haldwani, Kathgodam. They are the twin cities out there. So we would like to really recognize this stellar effort of Brijlal Hospital and Research Center located at Haldwani, right at the climb of the Nainital Hills, for having emerged as an oasis of medical service excellence, delivering high quality and integral healthcare to residents of and tourists to Kumaon alike. And this hospital is duly recognized and accredited by NABH, a very fine facility serving the tertiary level interests of patients as well. So we have with us representatives from Brijlal Hospital, Dr. Yeah. So I would request him to accept this token tribute and also remind us more about their work.
Dr. Deepak Mehrotra, please.
He was there right away. Okay, so we move forward in abstention because the other award which we want to give away is to the International Health Division of the Directorate General of Health Services. जिस प्रकार से जो सैनिक हैं सरहद पर हमारी रक्षा करते हैं, this very International Health Division, it has lot of APHOs, PHOs and LPHOs. They have health defenders right at the point of entry across the country. So they are being recognized for having adroitly defended India from the invasion of infectious diseases from international quarters through the efficient and expedient action of various point of entry health organizations at the airports, at the ports, and at the land transitions over there. Professor Dr. Atul Goyal, sir, he was to be with us, but for certain reasons, we confer this in his absentia, and the International Health Division Director General of Health Service. And last but not least, our Saptarishi, our seventh Saptarishi in the 40th year of its inception, the legendary Apollo Hospitals, which got founded in the year 1983. They are being recognized with Dr. Keshav Baliram Hedgewar Integral Healthcare Honor for having created an ultra-impressive, privately held integrated healthcare ecosystem in the country with over 73 plus hospitals, 400 plus clinics, 1100 plus diagnostic centers, 200 plus telemedicine units, 5,000 plus pharmacies, having 11,000 plus doctors on board, serving more than 10,000 pin codes of the country, in and around the whole, I would say, Ek Bharat Shresth Bharat, Ahmedabad, Argonda, Bangalore, Bhubaneswar, Bilaspur, Bhopal, Chennai, Delhi, Guwahati, Hyderabad, Indore, Kakinada, Karur, Kolkata, Kochi, Lucknow, Madurai, Mumbai, Mysore, Nasik, Nellore, Trichy, and Visakhapatnam. And they have the exhaustive coverage across the medical specialty areas of cardiology, neurology, gastroenterology, the whole space of it, and they are extending the authentic, affable and affordable care. So an initiative which is self-funded, privately funded, which is serving the nook and cranny of the country. We also felt that जब हम integration की बात करते हैं तो public और private दोनों healthcare ecosystems की अपनी एक relevance है, अपनी एक ज़रूरत है, अपना एक विशिष्टता है. So with this, we conclude the commemoration of the Integral Healthcare Forum with our Saptarishis today, and we are really fortunate enough that each one of us could spare time for this short and sweet ceremony. And I would request Dr. Surbi to pass on the vote of thanks, some concluding words. And probably I would request Dr. Sumati Sundar, because she's the outlier out there, the World Music Day, something more on musical therapy as to what, like I come from IIT Kharagpur, I'm a technocrat. My institution has the medical technology division, and we had Professor Kiran Seth from SPIC-MACE. And at that point in time, Professor Kiran Seth advised in one of the student congregations that take a Tanpura, a digital one, and when you guys study, you put it over there and that will take you to an alpha state of mind or something like that, and your concentration would increase and things like that. So music was more from a mood changing, joy, happiness. But what Dr. Sundar is doing is a clinical medical therapy. So I would really to conclude this forum with some musical extravaganza, because that is what joy and jubilation is all about. And I would request Dr. Sundar to speak for a few moments more about the musical therapy and how we can adopt it in our day-to-day lives.
So there are two things. One is, if it is going to be a restorative healthcare strategy, and, if we want to look at a holistic approach of treating the patient with working with their, not only with their physical well-being, but also psychological well-being, social well-being, and spiritual well-being. Music is the different facets of music can connect to the physical aspect of a person. And as Dr. Surbi was telling, that the neurobiology and the neurophysiology and the immunology and the endocrinology of music, has given us a lot of research that music can impact the hormones, music can impact the immune system, music can impact the autonomic nervous system. And it's possible that, we can make changes in the blood pressure, heart rate, and, the physiological responses like that. And we can make changes in the mood, in the depression and anxiety when patients are there. It is possible that we can work with reducing their anxiety or depression, which is going to, increase their pain perception. So one of the important applications of music therapy would be to have pain management. Even World Health Organization recommends a complementary therapy for pain management, apart from, the medications, the 3-level tier of using how medications could be used. Music is used more like, it is a way to bring down the functional issues with the functional symptoms, like, they may become anxious because of pain, and because of anxiety, the pain may increase. So they become depressed, and because of depressive feeling, the pain may increase. The quality of life may come down, and because it has come down, the pain may increase. So not only the physical levels of pain could be, they could be distracted, and, they could also have positive emotions and positive thoughts, which could make an impact on their anxiety levels and depression levels. And, it can also be used as a way to socially connect with people around. When they feel lonely, it is a way by which, they can be used to connect with each other. We use music therapy as part of procedural support. When patients undergo procedures like angioplasty or angiogram, music therapists, qualified music therapists, are there in the operating theater, in the catheterization lab, and, in other places like hemodialysis, where hemodialysis is there. So they look at, music is considered to be a mind-body medicine, that it can make an impact on the mind, which can make an impact on the body, which can get translated into health-related behaviors. And this is basically the principle of integrative medicine, that the whole person had to be taken into consideration. So the idea of music therapy is to create an optimum healing environment, and the qualified music therapists use different methods, like listening to music, making them sing, make them play very simple instruments that anyone can play, write songs for them, compose songs for them, right? So, there are different methods and different techniques that are used, so that they use music as a way to connect with people. So one is, when patients visit the hospital, pathogenesis is the primary focus for the doctors. They have to look at how to, diagnose a disease, look at what is the cause for the disease, and how to treat them and cure them. But salutogenesis is looking at factors, or focusing on factors, so that, they could be helped to heal themselves, right? How to prevent. So it can also be a preventive healthcare strategy, that they are able to understand how in an everyday life that they can use music for improving their emotions, to have positive emotions generated, because the cutting edge research now is, establishing the relationship between music and health, is that how emotions, positive emotions and positive thoughts have an impact on the health, and how music, if it is going to be integrated in an everyday life, knowing the science behind the relationship between the music and health could take us to place like, we can, and many psychosomatic diseases because of the stress, how we can learn through music, how it's possible for us to handle the stress, how we can develop resilience, how we can on an everyday basis deal with our stress, so that that could be our resource. On so one side, the restorative healthcare strategy, which is supporting the genesis, supporting the doctors with the reference to, the holistic approach of treating the person. Nobody says, can we treat the heart in ward number 3? We always say the person has to be treated. It's not the heart in ward number 1, or the lungs in ward number 2, or the special room, patient who was had a traumatic brain injury. So a lot of research has been established, especially in the West, and we have also through, especially the Institute of Salutogenesis and Complementary Medicine, Mahatma Gandhi Medical College has come out with a lot of research in creating evidences, even in a small way, from case studies to experimental studies to the golden standard randomized control trial. So we have different kinds of evidences levels available, so that we are trying to, on one hand, our country is so rich of traditions and cultural practices and healing mechanisms which talk about music and sound. Our ancient wisdom, they spoke in a different language, and just because we are not able to understand the language that they had, we are having a problem. Like, we are saying that we want evidence-based practice, but we are trying to find out the science behind what made them to engage in such healing practices. So it is evidence-based practice is basically trying to find out evidence in terms of biological evidences, psychological evidences, and social and spiritual ways, how music could be integrated, and how even the staff of the hospitals could be given musical experiences, so that we could tackle their stress, how the nurses could use music in everyday life, how the neighboring communities that we use NAD and NAD related resources for as a preventive healthcare strategy. Nobody needs to fall sick to have an a music therapist hired to work with them. So that's ultimately the idea, that one is working on promoting health and wellness through music on an everyday basis, how music could be integrated, and that's how the students are trained, or the professionals are trained. So without training, they do not know the mechanisms. Music therapists will be able to explain the biological mechanisms, they will be able to explain the psychological mechanisms, they will be able to explain what is the social context in which music made an impact. So they will be able to talk about the autonomic responses aspect, they'll be able to talk about the immune responses with whatever research evidence. And so they will be integrating research, and on one side it is supporting pathogenesis, then it's called an intervention, right? So there is some pathology involved, which is not only biological aspect is going to be taken care of with the doctors, but the psychological aspect and the social well-being aspect and the spiritual well-being, which is also contributing to the physical well-being, also are taken by the music therapist. And so that is what we have been doing for for about 12 years. And there are collaborators in Gujarat and Assam research centers, cancer research centers, who are coming forward to understand. Of course, it's a very small, very young discipline of 50 years old. In India, probably, we can say it's 10 years. Though we have all the traditions, we have to speak in the language that's to be understood by the professionals. If I'm going to say, okay, I'm going to sing this raga and I'm going to make a dead man alive. So, I mean, we don't have a position there, we cannot talk like this. So, it has to be spoken in the language that is understandable to the healthcare professionals in an evidence-based manner. And so that is something that has been going on for some time, but yet so much to be done. So much to be done.
Thanks a lot, ma'am. Thanks a lot, ma'am. It is the passion and the perseverance which CSMT is bringing to the table. And what a great yoga of health and music on the World Yoga Day and the World Music Day. I would say, Dr. Subhi, closing word of thanks, and we will conclude. Yeah.
So on behalf of Rethink India, I thank all the distinguished illumining bodies and distinguished stalwarts, I would say, from across the nook and corner of the country. We have from Chennai, from Bhopal, from Haldwani, and Indian Pharmacopoeia Commission as well, Dr. Shashi Gogia, of course, which is pan-India. And so would thank all the Saptarishis, the Saptarishis of the Mandal of the sky, the glittering sky today, that we take a pledge that we, take this movement of integral healthcare further on International Yoga Day, uniting all the healthcare modalities from music therapy to Ahar to Reiki to Ayurveda, from the Ayush side of it, and also even the other healing modalities, be it pranic healing, be it the healing tattva to be ignited and kindled amongst us all, and we collaborate and come together to heal the patient, not just physically but spiritually and psychosomatically, and with his complete well-being, which we say is Arogyata.
So we take your leave and with pranams. Thanks a lot for taking out time from your extremely busy schedules. It's entirely the honor of Rethink India Institute and the Arogyan Institute of Integrated Medical Sciences to have presented these to contribute to all of you. Namaskar.
Namaskar.